This is the Steve Gruber Show.
All right, let's get into it as we kick off another brand new hour here of the Steve Gruber Show. Starting a short week after a great holiday weekend. Hope you enjoyed it. A lot of things to get to today as we continue to bring you up to speed on everything that matters so that you are the smartest person when you go out on the street today. The question, who do you want in your foxhole? Well, I'd take you because you're here. Three big things this hour. Number one, the Democrats used to think it's child's play to have young people line up and vote for them, but that is changing and changing quickly. In fact, the teenagers and 20-somethings now support the GOP by double digits. Uh-oh. Number two, nearly 60 people shot in Chicago over the holiday weekend. At least 11 of them are dead, but more could die. That's okay with the mayor and the governor who say this is normal. No need to do anything. We don't want the National Guard here. No, let's just keep killing people in the streets of Chicago. And number three, let's discuss, I haven't done this in a while. Let's discuss COVID, all right? The failed policies and the guy who resigned from the CDC or forced out, doesn't even matter. This guy, if you missed it, the guy that ran COVID policy for the CDC primarily, a walking advertisement for kink and fetishes, and frankly, I don't even know what. But predictably, he's a victim. Now, he's a victim because he's been forced out. Whips, chains, yeah, and the CDC. The guy that had numerous kink videos, it was all over the internet. Bizarre, sadomasochistic, gay fest themes, trying to sell you now, get this, that infants need COVID shots. You see, since he's left the CDC, now who's he working for? Big Pharma. Dr. Dimitri Daskalakis. Here he is.
We're seeing the tip of the iceberg. So right now, I think probably the most prominent demonstration of that is what Secretary Kennedy did with changing the childhood schedule for COVID-19. In that, we were directed that only children with underlying conditions would be the ones that should qualify for vaccination. That's not what the data shows. 6-month-old to 2-year-old, their underlying condition is youth. 53% of those children hospitalized last season had no underlying conditions. The data say that in that age range, you should be vaccinating your child. I understand that not everybody does it, but they have limited access by narrowing that recommendation. Insurance may not cover it.
Oh. So little tiny kids need to be jabbed with this? Mm-hmm. So then when confronted with comments from Robert F. Kennedy Jr., they question how the CDC has operated in recent years. Daskalakis just blames Kennedy. You see, whatever's gone wrong at the CDC for years, how COVID policy was handled, how vaccines were pushed out there, it's Kennedy's fault, you see. Listen.
The CDC is an agency that is very troubled for a very long time, and anybody who lived through the COVID pandemic and saw all of these bizarre recommendations that were not science-based, all the misinformation. There's a lot of trouble at CDC, and it's going to require getting rid of some people over the long term in order for us to change the institutional culture and bring back pride and self-esteem and make that agency the stellar agency that it's always been.
Yeah.
Dr. Daskalakis, is that what the CDC needs in your view, an overhaul?
I think the CDC really is a place filled with great scientists and experts. And I think that if CDC is being characterized as troubled by Secretary Kennedy, I think we have to turn the mirror back to him, because I think that the trouble is emanating mainly from him.
Mm-hmm. It's his fault. Meanwhile, over on Bill Maher's program, Bobby Kennedy showed up, pointed out what a failure the COVID vaccines truly were and are and still will be. Here's what he said.
There's 25% of Americans who believe that they know somebody who was killed by a COVID vaccine.
Killed?
Killed. 25% of Americans, 52% of Americans believe that the vaccines are causing injuries, including death. 52%. Oh, if you look at the clinical trial studies, the actual studies that were done that were released of the Pfizer vaccine, Moderna has not released it. if you look at the Pfizer vaccine, there were 22,000 people in the placebo group, 22,000 people who got the actual vaccine. And the people who got the vaccine had a 23% higher death rate from all causes at the end of that study.
But that could not be the disease itself?
No, well,
because we know that
if it is, then the vaccine doesn't work, does it?
Well, it's certainly. Well, no, that's not. That's.
And if they die, then the vaccine doesn't work. But wait. How could that be true, that the vaccine didn't work? I mean, Pfizer announced in 2021 the jab was 100% effective. I mean, it was remarkable. It was a miracle of science. It was perfect. If you don't remember, listen to this.
We do have some breaking news. Drug maker Pfizer just announcing the results of its vaccine trial for adolescents. It says its coronavirus shot was 100% effective at preventing infection and sickness among 12 to 15-year-olds. This could be a major game changer for reopening schools across America. So joining us now is Dr. Chris Purnell. She's a public health physician and fellow at the American College of Preventive Medicine. Dr. Purnell, great to see you. 100% effective? Is that, I mean, John and I haven't heard numbers like that. Is that unusual to find that efficacy rate?
Well, that's even higher than what we were reported when we had 95% efficacy in adults. Look, we know these mRNA vaccines are a game changer. The technology is different. The technology is very promising.
I mean, it's 100%. I mean, you know, it does not get any better.
We do have some breaking news.
100%. 100%. Yeah, how'd that turn out? I think that Daskalakis pushing vaccines now for kids, for little kids, tells you everything you need to know. The answer is no, absolutely not. At this point, why would anybody take that? I mean, whether you believe it worked or not, you would have to have some questions, wouldn't you? Remember, they called them breakthrough infections. Remember, they were breakthrough infections. They were unbelievable. They had these breakthroughs, and nobody could understand what was going on. Yeah, well, guess what? The breakthroughs weren't really breakthroughs. They were just infections because they didn't do anything. This segment of the program brought to you by PureClean's Veterans Initiative, PureVet program, where veterans find purpose in property restoration and entrepreneurship. We salute those who serve. You can find out more at purovet.com, purovet.com, or 855-PuroVet. Yes, you can get help. If you're a veteran, you can get involved with a brand new corporate venture, purovet.com. Find out more. I'll be right back.